Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. Hi, Julie. Thanks for joining us today.
Hi, thank you.
Is it true that Illinois is no longer trending downward as we were a month ago, and we are considering ourselves in an uptick right now?
Yes, that is absolutely what's going on, including in Champaign County. We are seeing a lot more transmission going on. We're seeing a lot of younger people under 30, although there's still quite a few in the older categories as well, like 40s and 50s. But yeah, we're seeing most of the transmission right now happening in the 30 and below category.
There's a rumor that the state's information of cases is now no longer diverted through the CDC. It's going through the administration in Washington, D.C. Is that true? Are we getting accurate information from the CDC these days?
Well, so what's happening, and that is concerning. So what has happened is that the hospital data is used to just go directly to the CDC. Everything's done electronically anymore. And now it's having to be routed through HHS first, Health and Human Services. That makes no sense to anyone involved in this. You want the data to be as accurate and timely as possible, because that is what decisions are based upon. There are metrics for everything out there, and the CDC needs that information and to be able to provide it back to the states and the regions and the localities so that they get accurate information on such things as, hospital bed usage, ICU usage, things like that. So I have no idea why that's happening. That should not be happening as far as I'm concerned. It never has happened, and I don't know the need for that. What I don't want to see is any more of this incorrect information getting out or just muddying the waters with the data. This is something that should not be being messed with. Now, locally, I know that, we have obviously control of our own data because we're getting the direct case numbers. We report them right to the state. CUPHD reports them on our page. And then we can also get information directly from the hospitals if need be. So I don't want to see something where data is either being hidden or messed with in any way, because that is important tools for planning and for action.
I have friends locally who have been tested at the mall, which is painless and quick for your response, as well as now on the U of I campus, the saliva test. Is there one test that's more effective than the other?
Well, they're both really effective. I mean, it's as effective as can be. I believe that the saliva test probably has fewer false negatives. The type that's being used out at the mall and basically everywhere else has about a 20% false negative rate. That's why you can't, for example, if you're in quarantine and you test negative, you can't get out of quarantine because of that test. You still have to remain in there for 14 days. So the testing is what we have, and mostly what the testing is for is a public health tool. So, I know a lot of people are going out and saying, oh, I'm getting tested so I can do this or not do this. That's not really a good idea because of the false negative rate of 20%. So that means you could have it and then not know it. What it's really good for is catching the ones who are positive, and then public health comes in, put them in isolation, come in, determine through contact tracing who their close contacts are, put them in quarantine, and then that stops that outbreak. And we have a ton of outbreaks going on right now. So, we would really appreciate it if people would not do that. Stay home more, stay away from people. Don't go, if you're going to go out, stay away from people and mask in public, because it's too early to be seeing this high of numbers already. So that's concerning. School isn't in, the U of I's not back, and yet we're seeing this really concerning increase in numbers and in positivity. So if we're going to do things and get the economy open up, everyone's going to have to do their part. And in our county, that means we need to wear masks when we're in public, continue washing your hands, and stay away from people. And if you feel like you need to go somewhere where there are other people around, if it looks unsafe, don't go there. You need to be 6 feet from other people not in your household at all times, or you risk exposure.
Again, I know you're not a lawyer, but you seem to have answers for this type of question. Places like Walmart, CVS, Schnucks, they all require masks now.
Mm-hmm.
People say that you can't take away their freedom, require them to wear a mask, but a private business can. Am I correct? You walk into a grocery store, they have a sign, you have to pull your mask up.
Absolutely. Places can have those rules, and there can be ordinances that say you have to wear a mask. All that stuff is perfectly legitimate. There is no constitutional right not to wear a face mask if by doing so you could be potentially spreading an infectious disease. This is all well, it's all well documented. There's precedent for this for various other infectious diseases. So it's not something to, first of all, it's not that big of a deal to wear one when you're going into a store. So we need to quit pretending like it's some big onerous, thing that is, infringing on somebody's rights. It isn't. Wear the mask when you go into public, and absolutely these places can tell you to leave your store, and if you don't, I would assume that would be trespassing. I don't know the exact charge for it. I do know in some places that's the charge, but I don't know exactly what it would be here. But if you are going into places, you don't have to go into places. If you don't want to wear a mask, stay home, have your groceries delivered. But you do not have a right to go on when places say that this is what you need to be doing. You need to be doing it.
One of the mandates for returning to school is that those that are there need to wear a mask. Since we spoke last, most of the area schools have come up with plans. Unless the kids have IEP or 504 plans, bilingual education, or they need free and reduced lunches, they're going to put kids online on the online academies. For the best of bad solutions, is this the safest way to do it?
Well, so again, public health, I always keep telling people this, we have the easy job. We just lay out, this is the guidance. This is who statistically is at more risk for negative outcomes. This is the safest thing to do. The safest thing to do is not to be around other people. So that would be doing online classes, for example. The schools have the really tough job because they have to operationalize our plans. Okay, so they have to operationalize this guidance. That is hard because there are a million different things that play into whether a child is better off at school or at home. And there's going to be give and take. There's going to be there's going to be good and bad with each decision that's made. That's why our guidance basically just puts out the information and says, whether you're a teacher or whether you are a staff or whether you are a kid or whether you have someone living in your home, these are the things that are going to put you more at risk for a negative outcome. So then they have to decide that. The families have to decide that. What we as public health wanted to see was the schools were offering options so that families could choose to either send their child to school or keep their child online. We knew that most of them would have the in-school services. I guess what I should say is we wanted to make sure there was an option for people who really needed to stay at home or teach from home or something like that, because that is the safest, and there are people that are not going to want to be in the schools or any place else due to their own health situation.
And these are plans. Again, Parkland College has made a plan to do most online, some in person. U of I is planning on having students move back. Unit 4, Urbana, they have plans. However, the virus has plans as well. So any of this, even though we've done all of this planning in advance, could be usurped by the virus and we could close up again?
Right. I mean, the schools, for example, schools or businesses, workplaces, no one is going to be able to prevent the virus from getting in because people are going to do what they do on their weekends and everything. We could all help by making an effort not to get infected when we're not at work. But the fact is, no place is going to be able to keep out the virus. What we are doing with our guidance is to say that if it gets in here, this is how to limit and prevent an outbreak. But if you start seeing things like schools having a lot of kids or a lot of staff or a lot of faculty positive and having issues, then yeah, we're likely to see see changes. We're likely to see places go to all online, for example, or, we may get to a point if the cases just keep going up where we have to move back into, level 4, I'm sorry, level 3, or, even level 2. It just depends. What's happening, you can look at these other states where they just opened up and just thought, okay, well, let's see what happens. Well, we see what's happening. We all knew what was going to happen, and that is what's happening. There are just exploding numbers of cases, and there are more deaths, and there are, there's probably going to be some long-term disability. I like to keep reminding people that this is not a virus to mess with. It's been on the earth in front of us for 7 months. It's just beginning to be studied. Mostly what we're focused on are cases and mortality. What is not being looked at as much is like long-term disability, long-term morbidity, or even what some of the morbidity is, like what are some of the problems that people are having. And I can tell you that the things that I'm reading about are not good. There are people who have not even had that bad of cases who have, lung scarring or organ damage or cognitive problems or memory issues, circulation problems. So it's not something to mess with. It's not something to say, oh, it's like a cold, or oh, it's like the flu, because we have no idea. We also have no idea what may happen, 10 years from now if you're infected with this virus. Is this going to be one where, it leads to something else like hepatitis C leads to liver cancer, or hepatitis, or I'm sorry, human papillomavirus infection leads to, cervical cancer or anal cancer or oral cancer or whatever. You just don't want to risk it. But people are risking it, unfortunately.
I'm glad you brought up the comorbidities of this, because recently, in addition to diabetes and hypertension, some of the other pre-existing conditions, asthma, cystic fibrosis, those are the people that we've been saying pre-existing conditions that we need to protect. Cancer has now been added to this list. Is it safe to assume that the people that this could affect long-term, this is still fluid, we're still figuring this out?
Right. This is what people don't seem to understand. This has only been around for 7 months. We have no idea. The only way that they find what is causing the worst outcomes is, by having worse outcomes and then studying those and finding out, are there associations between things? Are there more people with this type of disease that seem to have this? So yeah, we're going to continue adding things to this because there will be more and more stuff discovered. And it's concerning that it's not being taken seriously enough by enough people. I don't understand it. I don't understand the turning masks into a political issue. Just like that would be like saying hand washing is infringing on my rights, or any other number of things. It's ridiculous. I don't know how we got to this point, but we have got to get beyond it if we are ever going to get back to some sense of normal.
We are at this point because many of our federal and state leaders are making masks a political issue. Florida and Texas have had more than 10,000 cases for at least the last 5 days. In Florida's case, the last 7 days in a row. Why won't they mandate mask wearing? It is that simple.
Well, I don't know why they don't do it, honestly, but we have, mandated mask wearing in Illinois. I remind people too, but that doesn't mean that everyone's doing it. I just don't even know how to make people be concerned about other people's health, because that's really what we're talking about. You don't know if you have it. I don't know right now if I have it. So if I go out and I'm around anyone, I'm going to have that mask on, because I couldn't live with myself if I gave someone coronavirus and it ended up killing them or putting them on a ventilator or some other horrible outcome. That to me is it's not even worth thinking about. I'm just going to put a mask on. Same thing with, I wouldn't think of making someone food without washing my hands. It's just, I don't know. It's very frustrating, but people have to act responsibly on their own. There's no one that's going to, make them do it. We can have ordinances, we can have laws, but it really boils down to everybody just doing the right thing.
Is a mask enough? I see a lot of people with the face shield. Should we be taking it up another level?
Well, that's not, that's not recommended. Now, depending on what you do for a living or who you're around a lot, because for example, little kids are likely just to sneeze right in your face. They may not have learned proper, etiquette. So maybe if I worked around little kids all the time, I might consider it. But for the most part, if we can get people to wear a mask and the kids are wearing masks, that's going to keep that in.
I just took my son, speaking of kids, to the doctor, and she basically made us promise that we would be getting flu shots. I forgot about flu, so I looked it up. Can you get influenza and COVID at the same time? To your knowledge, is that a thing?
Absolutely. You can get COVID and flu at the same time. We are about 100% sure that we saw that last winter, but we couldn't get the COVID testing done. You can also get influenza A and influenza B at the same time, or one right after another even. But the real importance of getting the flu shot is we cannot have our healthcare system overrun. And if you have pandemic going along at the same time that you have flu, and I guarantee you at the beginning of this, you're not going to know if it's flu or COVID. Nobody's going to know until there's a test. So if people would get their flu shots to prevent as much as humanly possible, that would be a great help for the healthcare system, because we do not want to overrun it. And every year people die from flu. Every year people are hospitalized with flu. So we want to avoid as much of that as possible.
One more question. Do you live in a state of waiting for the other shoe to drop? That feeling when you're on an airplane and it's silent for a second, but turbulence is about to hit? Or are you in a positive mind frame? I mean, we're not even done with the phase 1 of this disease.
I sort of do always. I'm always sort of waiting for, what's next. So yes, since COVID has been around, I am in more of a heightened sense of, oh my God, what's next? I do have that. But in general, I'm very, very glad to be in this county. Of all the places, I feel so bad for some of my colleagues around the country. I really do. For the most part, when you go out in Champaign-Urbana, you see people doing the right things. You just do. So I'm happy about that. We have a lot of resources here. I've said since the beginning of this pandemic, not all communities will fare the same. We're seeing that. We're seeing it. That it's just what happens. And a lot of it is just, it comes down to individual behaviors. And are people willing to protect other people's health? Even if it means inconveniencing them a little bit, are you going to do the things you need to do? And I think that we're seeing it in our community that we do that. I would like to see certainly more of it, because I would like to see our cases go down. I'm sure, it'd be great before we get into the fall and winter. I would love for a lot of my staff to be able to get out of here and, have a vacation. But so in that sense, I am probably a little more agitated than normal, a little more on edge, but I do feel like our community is really doing a great job. I do want to remind people that, especially, first of all, if you're going out in the public and somebody in the store or in the restaurant or wherever tells you to wear a mask, do it. And if you don't want to wear one, then don't go there. Certainly don't stand there and give your opinion to the person who is who is their job to tell you to do that. They don't care. It's ridiculous. You're wasting their time. You're wasting everyone's time. So please don't do that. And the other thing is, give the poor people working in the schools and other places doing guidance, give them a break. This has got to be one of the hardest things that they have ever had to work on. They are never going to please everyone. It'll never happen. What we're trying to do, whether it's public health or the schools or the businesses or the daycares or whatever, we're trying to give you the information that you need to make the decisions for you. So don't try to cram a one-size-fits-all, thing on everyone. if you don't want to wear a mask, you have the option. If you don't want your kid to wear a mask, you have the option of staying home, having your kid be at home. If you don't want to, if you do want to, or if you have an at risk, you have options. If you're at risk, I mean, you have options. So that's really, what I think the best we can all hope for is that the schools have been, are looking at things to give a lot of options to people. But, seriously, cut them some slack.
I wouldn't call you agitated, by the way. I would say more spirited, vigilant. I think there are more ways. We'll describe you that way. I want to thank Urbana Mayor Diane Marlin for letting us do these updates every week. I didn't get the memo from our producer, Jason Liggett, to wear blue today, so the two of you matched. I was left out of that decision. But Julie Pryde, Administrator of the Champaign-Urbana Public Health District, thank you so much for helping me today and for helping all of us all month and for the past 7 months.
Absolutely. Thank you.